want to welcome everyone and apologize for being late. We had a conference that ran a little longer than normal, discussing some things you may have been reading and hearing about lately. This is a hearing on the impact of Obamacare on job creators and their decision to offer insurance. The committee will come to order, and consistent with the policy of the Oversight Committee, I will read the mission statement. We exist to secure two fundamental principles. First, Americans have a right to know the money Washington takes from them is well spent, and second, Americans deserve an efficient, effective government that works for them. Our duty on the Oversight and Government Reform Committee is to protect these rights. Our solemn responsibility is to hold government accountable to taxpayers, because taxpayers have a right to know what they get from their government. We will work tirelessly in partnership with citizen watchdogs to deliver the facts to the American people and bring genuine reform to the Federal bureaucracy. This is the mission of the Oversight and Government Reform Committee. I will now recognize myself. Give me just 1 second for an opening statement. I will recognize the gentleman from Illinois for his opening statement while I am in the process of finding mine.
Well, thank you very much, Mr. Chairman. And before I begin, let me take the opportunity to acknowledge the presence of a dear friend of mine, and certainly a friend to all of the people who have been in the House and in the Senate, a former distinguished member of this body who was also chairman of the Small Business Committee and a member of the United States Senate. Senator Jim Talent is with us, and I'm pleased to see you, Jim. I must confess that I had two bills that Jim and I co-sponsored that were passed into law. And so he represents some of the proudest moments of my tenure here. So I'm delighted to see him. Thank you, Mr. Chairman. For several years, I've been a supporter of a national health plan. Good quality, affordable health care should not be a privilege afforded to just a few. The Patient Protection and Affordable Care Act provided a pathway to bring affordable health care for the masses. It balances the needs of businesses and workers with accessibility and affordability. Large and small businesses consistently express their concerns about rising health care costs. The Affordable Care Act addresses this concern with cost containment measures for the employer, such as small business tax credits, insurance market reforms, rate reviews, price transparency, and the creation of health marketplace exchanges, just to name a few. The anticipated reductions on health premiums enable job creators to hire more workers, increase salaries to maintain their workforces, and to reinvest in new technologies for their business growth. The Center for American Progress estimates that health care reform that reduces premium growth will add 250,000 to 400,000 jobs annually over the next decade. The Affordable Care Act also addresses the needs of workers. The Act eliminates job lock, which discourages workers from seeking new opportunities for fear of losing health coverage. The ACA supports the entrepreneurial spirit of the American workforce, as nearly 10 million self-employed Americans have the ability to purchase insurance for their families. Additionally, the Act makes health insurance affordable with premium assistance for eligible employees. Lastly, a recent Harvard study estimated that one American family filed for bankruptcy every 90 seconds in the aftermath of an illness. 3/4 of them had health insurance at the time of the precipitating health event. In addition, medical debt burdens families with the inability to pay for other expenses, contributes to credit card debt, and causes people to delay necessary medical care. The Affordable Care Act ensures that these nightmare scenarios will no longer be common. In my district, there are many Medicare and Medicaid recipients that have established community health centers as their medical homes. Medicaid beneficiaries that rely on health centers for usual care were 19% less likely to use the emergency room at a hospital than other providers for non-emergency and usual care services. Overall, health centers save the health care system between $9.9 billion and $17.6 billion annually. Community health centers provide high-quality health care regardless of the ability to pay, and health centers in Illinois have a tremendous impact on our economy and employment. In 2008, 40 health centers operated over 350 sites, contributed almost $1 billion to the Illinois economy, and directly employed almost 6,000 Illinoisans. Indeed, for every 10 people employed by an Illinois health center, an additional 4 jobs were created in their surrounding communities. Illinois health centers served over 1.1 million patients, nearly 80% of whom had no health insurance, helping them cope with chronic health conditions and general health issues to be able to work and care for their families. Repeal of the health care law would eliminate $11 billion in support for community health centers over the next 5 years, funding that will nearly double the number of patients served today and greatly strengthens Illinois' economy. I know a little bit about health care, given the fact that my congressional district has more than 20 hospitals, 21 to be exact, 4 medical schools, a large number of community health centers and other outlets. And I can tell you that health care is the lifeblood of our community. Simply put, the Affordable Health Care Act is indeed progress. I thank you for this hearing and yield back the balance of my time.
I thank the gentleman from Illinois. First, I want to thank our distinguished witnesses for your patience and for your willingness to lend us your insight and your perspective on what all of us agree is a very important issue. As we sit here this morning, Washington is debating the relative merits and demerits of deals or plans or solutions, whatever euphemism you want to use, averting the short-term debt crisis. However, our country continues to face long-term fiscal crises, some of which is rooted in the cause that we need substantive reform and return to our founding principles. Quite simply, government is too big. Out-of-control spending and over-regulation have threatened America's credit rating and crippled businesses' ability to create jobs. When asked what the single greatest impediment to job growth is in the United States today, and I hasten to add, I come from a state with about 10% unemployment, and some counties are as much as 20%. But when asked what the greatest impediment to job growth is in the United States, the founder of Home Depot simply responded, the U.S. government. That is a stinging indictment. Our dire economic situation requires us to take a hard look at every dollar we spend and fundamentally reform programs headed down the wrong path to fiscal insolvency. At the same time, we must be enacting pro-growth policies paving the way for American companies to grow and expand, creating the jobs that will spark a broader economic resurgence, which brings us to why we are here today. The current health care law was marketed to the American people as a means to provide high-quality, low-cost health coverage options to every citizen in the country, while ensuring that those who like their current coverage can keep it. However, time and time again, we have discovered examples exposing this political myth. The uncertainty surrounding the law's broader implementation and the expectation of future taxes have worsened an already dreary economic picture. While we often hear about the looming debt crisis, we are also in the midst of a job crisis, one that Obamacare has done nothing to ameliorate and in many instances has served to exacerbate. From new taxes to increased government mandates and regulations to picking winners and losers based on arbitrary criteria, the new legislation burdens businesses with confusion and uncertainty, the exact wrong prescription for turning around our floundering economy. Further, as the full impact of certain sections become more clear, we are uncovering myriad disincentives and hidden taxes embedded within the law that serve to negatively impact businesses' bottom line. while CBO estimates the law will reduce the number of jobs by 80,000 by the end of the decade. And finally, instead of allowing employees to keep the coverage they currently have, tax subsidies in Obamacare will cause many employers to drop workplace health insurance, health coverage, forcing workers to purchase their own insurance, all the while skyrocketing costs and further deepening our nation's budget deficit. In a recent survey, McKinsey & Company found that 30% of employers will definitely or probably drop health insurance in 2014, a scenario not contemplated when the initial costs were calculated in a rushed, predominantly hidden legislative process. Thus, the Federal Government will yet again pick up the tab, an outcome that is simply unacceptable and untenable given the current fiscal climate. So, we are here today to examine the true impact of Obamacare on you, Americans' job creators, and whether employees across the country will be dropped from their current coverage based on Obamacare's arcane requirements. And with that, on behalf of all of us, other members will have 7 days to submit opening statements and extraneous material. For the record, we will introduce our distinguished panel. From my left to right, your right to left. Andrew Pudster is the CEO of CKE Restaurants, which I have a parenthetical that says Hardee's and Carl's Jr. My history could very well be wrong. I think Hardee's may have its origin in the upstate of South Carolina, and specifically perhaps in Spartanburg with Mr. Richardson and Mr. Bradshaw, but if I'm wrong on that, as I frequently am. Sir? Okay, good. Well, as usual, I'm close but wrong. Oh, my wife's listening. Grady Payne is the President of Connor Industries. Welcome. Mr. Will Morey is the President and CEO of Morey's Piers. Welcome. Victoria Braden is the President and CEO of Braden Benefit Strategies, Inc. Welcome. Mr. Brewer is the President of Lockton Benefit Group. Welcome, Mr. Brewer. Mr. Terry Gardner is the Vice President of Small Business Majority. Welcome. Consistent with committee rules, all witnesses must be sworn before they testify, so I would ask you to please rise and raise your right hands. Do you solemnly swear or affirm that the testimony you are about to give this committee will be the truth, the whole truth, and nothing but the truth? May the record reflect all witnesses answered in the affirmative. There should be a series of lights which mean what they traditionally mean in our culture. Green means go, yellow means speed up and try to get under the light, and red means stop. I'd love to come to Chicago. We will now recognize you for 5 minutes. The yellow light or amber light means you have about a minute left, and the red light means you stop. So we will begin with Mr. Pudster and go from left to right.
Thank you for inviting me to testify today on the impact of the Patient Protection and Affordable Care Act on job creation. As the Chairman noted, my name is Andrew F. Pudster. I am CEO of CKE Restaurants. With me today are Cheryl Soper, our Vice President of Benefits, in case you have any really difficult questions for me, Louis Farias, who is our Vice President of Government Relations, and also my sons, Matt and John. CKE owns and franchises 3,182 restaurants in 42 states and 23 foreign countries under the Carl's Jr. and Hardee's brand names. With our franchisees in the United States, we employ about 70,000 people. Our company is a job creation machine. We create jobs by building new restaurants. Each restaurant employs about 25 people, and we invest over $1 million in the community where we construct the restaurant. But our job creation goes way beyond our building of restaurants. Last year, we spent over $1.25 billion for job-creating capital projects, media and advertising, supplier products and services. For example, we spent $1 billion on food and paper products, which gives jobs to everybody from the farmer who plants the seeds or tends the herds, to the people that process and manufacture our products, to the guy who drives the truck and delivers it to the back door. We spent $175 million on media advertising, employing people in television stations, radio stations, and newspapers. We spent $30 million on repairs and maintenance, employing people that wash the windows, cut the lawn, fix the air conditioner, and slurry the blacktop. Our franchisees own 70% of the restaurants, so they spent, you would assume, about $70 million in addition to that 30. We spent $60 million on capital expenditures, building restaurants, remodeling restaurants, and investing in our infrastructure. The people we employ in these concentric circles that really grow out from our restaurants went to grocery stores, went to the movies, sent their kids to school, bought cars, bought houses, just creating jobs on a very broad basis, which is the way the free enterprise system works. And you can see other businesses with concentric circles growing out from them that overlap and really drive the greatest economy the world has ever known. I'm very concerned that in the coming years we'll be unable to create as many jobs as we would like due to the increased expenses necessitated by laws such as the PPACA. I'll start with the law's menu labeling provision. That requires disclosure of the caloric content of our products on our menu boards. Now, as a company, we support nutritional disclosure. We have and have for years had comprehensive, effective, and economical nutritional disclosure in our restaurants and broadly available online at our website. We estimate that should we have to replace the menu boards in all of our restaurants, the cost would be approximately $1.5 million. That's 17% of the $8.8 million we invested last year on job-creating new restaurant construction. Independent research done to date demonstrates that caloric menu labeling has no impact on consumers' eating habits. In other words, this was a politically correct solution that is ineffective and imposes unnecessary costs on American businesses that could better spend their money and their time creating jobs and economic prosperity. Nutrition disclosure can be accomplished effectively, comprehensively, and economically. The current law simply fails in all three of these respects. Now on to the ACA's mandatory medical coverage provisions. I'm not an expert on health care law other than how it impacts our company. I also know that there are people who believe universal health care coverage is beneficial, and I'm not here to debate that. However, there is a sacrifice that must be made to gain that benefit. The question is whether the costs are worth the benefits. The ACA will eliminate job creation and opportunity. Our best estimate, the ACA will increase our health care costs approximately $18 million per year should it be implemented as we currently understand the regulations. That's a 150% increase from the $12 million we spent on health care last year and approximately double the $8.8 million we spent on job-creating new restaurants. At this point, we do not intend to drop coverage for our employees, but the money to comply with the ACA must come from somewhere. We use our revenue to pay our bills and expenses, to pay down our debt, and we reinvest what's left in our business. That's how we create jobs. There's no corporate pot of gold we can go to cover increased health care costs. New unit construction will cease if we have to allocate the monies for that construction to the ACA, and building new restaurants is how we create jobs. We would also have to reduce our other capital spending, and capital spending not only creates jobs, but is important to maintaining and growing our business. We would need to reduce the number of our full-time employees and increase the number of our part-time employees. We would need to automate positions where we could and reduce compensations for the positions that we retain. As I speak with franchisees and encourage them to build new restaurants, I'm constantly met with concern about their economic futures. They're concerned about poorly conceived government regulations such as the ACA's menu labeling provision. They're concerned about the ACA's mandatory health care coverage provisions stifling growth and possibly requiring that they close restaurants that are marginally profitable now, but which would be unprofitable once the ACA comes into effect. The result is stagnation. The simple fact is that regulations such as those growing out of the ACA do impose costs, and those costs do result in reduced growth, stifling both job creation and prosperity. Prosperity is neither Republican nor Democrat. It's neither liberal nor conservative. It is a bipartisan issue. People are unsure about their futures. American people are suffering because they don't have jobs. American businesses want to create jobs, and we respectfully request that Congress review the ACA to determine which provisions can be administered in a way that reduces costs for the businesses they impact. We would further request that Congress review the ACA's provisions to determine which provisions, on balance, are detrimental to our nation's economic prosperity and eliminate such provisions. If done effectively, this review would encourage job creation and prosperity as well as better government. Thank you.
Thank you, Mr. Puster. Mr. Payne.
Thank you, Mr. Chairman and members of the committee. Thank you, Mr. Chairman and members of the committee, for this opportunity to testify. I'm Grady Payne, CEO of Conner Industries, with our headquarters in Fort Worth, Texas. We have plants in Texas, Oklahoma, Mississippi, Tennessee, Georgia, Florida, South Carolina, and Virginia. We supply cut lumber and assembled wood products to manufacturing companies for their shipping and crating needs, as well as logistics and supply chain management services. Our company was started in 1981 with 5 people. Today we're celebrating our 30th anniversary with 450 employees and 11 plants. Over 120 of our people today have been with us over 5 years, and 22 of those over 15. Ours is a commodity business which works off low margins. In each of our markets, we compete against companies that have fewer than 50 employees, as well as importing crating companies that we compete against. These companies will not be subject to the penalties imposed under the new law. It will give them an unfair cost advantage over our locations. According to the SBA, we are a small business, but not so by the Affordable Care Act. We are caught in the no-man's land between assistance and exemptions for smalls and waivers for large corporations and other powerful entities. We started our medical plan in the 90s and offered coverage to all employees. Most of our production line employees opted out due to cost. To meet federal discrimination laws, we were forced to create groups of employees and significantly reduce the number of to whom insurance was offered. This remains today. We offer coverage to approximately 140 employees and struggle each year to get 75% participation. The company pays approximately 55% of the total premium cost. Ours is a fully insured plan. The new discrimination rules created by the law have the effect of pushing us immediately into a self-insured alternative or face a fine of up to $500,000. The IRS has just delayed enforcement of the new non-discrimination testing until regulation can be written. However, our plan could be tested and penalized as early as next year. Without changes in these harsh penalties, we may be forced to drop our plan completely prior to the state-based exchanges even becoming available. In 2004, we were faced with even more difficult choice. Option 1 is to expand coverage to all our employees and pay the full premium cost. To do this, the additional cost would be approximately $1.5 million over the $750,000 we spend today on premiums. Option 2 is to expand coverage to all our employees and have employee-contributed costs set at affordable amounts based on the law's affordability rates and each employee's household income. If all employees stayed into the plan, our additional cost under this option would be estimated at over $1 million. Option 3 is to discontinue all policies and pay a non-tax deductible penalty of $2,000 for each employee for our 450 employees, plus some portion of a penalty for employee turnover during the year. The cost of this penalty option is well over $1 million, and it's not tax deductible. The impact of this law will cost our company $1 million or more no matter which option we take. And worse, some of the extra cost, if not all of it, may be classified as a penalty and not tax deductible. We would owe income tax plus the penalty. Today, these estimates total more than the company makes. We've been very blessed to be a profitable company even in these hard times. We have had to make many sacrifices in pay, bonus programs, and people. We have no tax loopholes. We are a tax-paying company. We're a company caught in the middle. As the law stands now, our 30-year business is at risk of being legislated out of business. How can this be? Our lives are in this company. We've done a good job for our customers, our employees, and all our families. We understand the goal of getting everyone medical coverage, and we agree that it is a worthy goal, but the massive cost hits us right between the eyes. We're too small to get favorable group rates or self-insurance contracts and too large by statute to be exempt, even though our profit centers are less than 50 employees in each location. There has to be a more equitable way to achieve this goal than to cripple a small business like ours. The ratio of cost to earnings is overwhelming for a company our size. We've seen bad markets before, though none as bad as this one. Our current capital expansion and business development plans are and will be stopped by this law because expansion and hiring requires cash. The impact of the law robs us of our needed growth capital. Our goals turn from hire and grow to cut and survive. I thank all of you for your service to our great nation and for allowing me to plead the case of Conner Industries. Thank you.
Thank you, Mr. Payne. Mr. Morey.
Yes, sir. Good morning, Chairman Gowdy and Ranking Member Davis. Thank you for the opportunity to speak today on this important matter. My name is Will Morey. I'm president of Morey's Piers. Morey's Piers is a family business that began in 1969. It began with very humble beginnings, a single giant slide on a postage stamp piece of property along the boardwalk along the sea in Wildwood, New Jersey. It now consists of 3 piers, 2 water parks, and 120 rides or attractions. Our operating season is primarily from Memorial to Labor Day. However, we operate shoulder seasons, weekends starting Easter and concluding on Halloween. We have 110 year-round benefited staff members, and we grow to an additional 1,500 seasonal staff members during that time. I'm privileged also to be the Vice Chair of our International Association of Amusement Parks and Attractions, which represents 3,000 fixed-site, supplier, and individual members in the United States, and I'll be Chairman of that organization in 2013. By way of perspective on the industry, our total domestic economic impact is approximately $53 billion. We employ 700,000, of which 600,000 are seasonal employees, typically young people in their first jobs, retirees, school teachers, and others supplementing their incomes during the summer months. Now, there's a tremendous amount of uncertainty related to this bill from my perspective, but there's one thing that I know at Maurice Pierce we can be certain about, and that is the inclusion of seasonal workers in the definition of full-time employee and the lack of suitable recognition of seasonal employees within our industry will cause severe negative consequences to our business. Now, I'm here to be constructive, and I'd really like to be a part of the solution, but the fact is, as it stands, the law will have a substantial negative impact to our industry, on our seasonal employees, and our permanent employees as well. From our point of view, the law is a large expense. It's an administrative nightmare. It's hard to see any appreciable benefit to anyone working at Maurice Pierce, but it's easy to see the negative impact on our ability to provide jobs and run our business productively. Now, it's important to note that our industry seasonal workers are hired for short temporary periods. They have a very different set of expectations and responsibilities than full-time employees, and they were clearly an element of the workforce that Congress did not pay close attention to when drafting the bill. The law will force businesses like Maurice Pierce to provide health insurance to seasonal workers, and as a result, we have the following concerns: immediate loss of jobs, including full-time positions due to decreased profitability; negative economic impact on the communities surrounding attractions such as ours, as operating schedules are adjusted and employment is curtailed; and the promotion of a seasonal labor society that schedules employees under 30 hours per week or terminates employment before 90 days. This will happen across the entire country, hurting both seasonal businesses and seasonal employees. And very importantly, and close to my heart, is the ability to be able to reinvest. Capital is an incredibly important part of the attraction industry, and reinvesting in our businesses is critical to creating growth and future jobs. Additionally, the administrative and compliance issues are, simply put, extreme. The majority of these workers are employed 5 months or less. By the time the 90-day administrative period passes, they will have insurance for less than 2 months at most. Many of these seasonal workers get their health care from other sources: parents, university, their primary full-time positions, and will opt out of our coverage. Yet we still have to do the following: ensure compliance, track work days, track average hours per week, offer the insurance, educate and present the insurance program, auto-enroll into the insurance program, get declinations to the program, and maintain records for all the above. Consider a workforce that swells from 110 to 1,600 employees, with individuals starting and ending their employment every day of the week throughout the season. Just imagine tracking and managing this information. This is unreasonably burdensome and will provide little to no benefit to the seasonal employees. Now, the bottom line is the inclusion of seasonal workers in the definition of full-time employee will needlessly cause severe negative consequences to businesses like Maurice Pierce, to seasonal and full-time employees, and to their communities. Ultimately, if this law is to go into effect, it should be amended to properly recognize the real world of seasonal employees and their tremendous importance to our industry and to our national economy. I'd like to conclude just by mentioning that, we really want to be a great business. We want to grow. We want to support our community. We want to create as many career opportunities as we can. That's what life in America is about. So please don't burden us with the needless compliance and other issues that come along with this bill. Thank you for your attention and consideration of this important matter.
Thank you, Mr. Morey. Ms. Braden.
Thank you. Chairman Gowdy, Ranking Member Davis, thank you for inviting me here today and to testify. My name is Victoria Braden. I am President and CEO of Braden Benefit Strategies. We are truly a small business. My business at this point has 3 full-time employees and 2 interns. And we deal with small businesses. That is our client base. We deal with companies that have 20 to 300 employees. In 2002, I started Braden Benefit Strategies with one employee in the basement of my home. Our business model was to be a resource for small businesses headquartered in Georgia, advising them on employee benefits, specifically group health insurance. My business plan was to expand our small group market and base, and then to grow a large individual market practice. In 2008, I moved the company into a building, took the risk, rented a space based on my long-term plan. At the end of our move, I was employing full-time, 3 full-time people, 1 part-time person, 1 intern, and myself. In addition, we sold our backroom services to 3 other health insurance agents, which kept their business viable. I had visions and a business plan to grow to 8 to 10 full-time employees. However, in December 2009, we looked at that, and it was time to add our individual health product, which is what we had looked at for our expansion, put in a call center, hired a full-time person, and put an aggressive marketing campaign together. On March 24th, the day after PACA passed, I had looked at my business plan before, knowing that it could be coming, and I made sweeping changes to my business. I eliminated our expansion to the individual health market, which I still to this day believe was a good decision, since individual market will most likely go to the exchange. I terminated that full-time person. I lost revenue from the sales we already had, which was accounted for $35,000 annually. And to these other gentlemen, that's just a small amount. To me, it's a person. It's huge. I also terminated a part-time claims administrator, and then I terminated my part-time accountant and outsourced that. The law eliminated my plans to grow and now have turned me into what could possibly be no business at all in 2014. On top of that, we advise small businesses on their health insurance options, and that has become very expensive. My company has had to go out and educate ourselves on the health insurance. When we get bad information or conflicting information because the bill is so intensive, we have to hire a lawyer, have to ask the lawyers for the differences. And oftentimes we go between 3 law firms, again, trying to figure out what it is that the law exactly says and how to advise our clients. It has also taken a huge financial toll on my business from the value of my business. With my business in 2007, I was looking at a value of $1.2 million, 2 times my annual revenue, and now I'm looking at a business worth 0. And the reason it's worth 0 is because our declining business will then be worth nothing at the end when PACA goes into effect. On January 1st, 2014, and I think this is probably the basis of why I'm here, we expect 22 of our 65 clients to immediately drop their group health insurance. The size of the clients that we service will have no cost to the employer to not have insurance. There will be no penalty and no fine. Of those companies, I expect 769 people to be added to the PACA or to the exchange rules. Through PACA, the taxpayer is now subsidizing the cost, when that happens, of small business employees' health insurance. Our conservative estimate of 462 will be the first year, and other businesses will leave shortly after that. We always said the young and the healthy would take this bill and make it worthwhile. It will not, because the young and the healthy will find a way around the bill. We are already seeing that through the self-funded small business pieces that are being developed. I would just ask you to reconsider not only the job loss of the bill, but the cost of the bill, both to employers and to the unexpected consequences of what's going to cost the United States government. Thank you.
Thank you, Ms. Braden. Mr. Brewer.
Chairman Gowdy, Ranking Member Davis. My name is Mike Brewer. I'm President of Lockton Benefit Group of Lockton Companies, LLC in Kansas City. On behalf of Lockton and our clients, I thank you for the opportunity to appear here today. Lockton is the largest privately held insurance brokerage and consulting firm in the world. Most of our 2,500 employee benefits clients are middle market clients, those with 500 to 2,000 employees. Our professionals are experts on last year's health reform law's provisions affecting employer group health plans. They have been instrumental in educating our clients regarding the law and analyzing its impact on our clients' employee benefits programs and their budgets. In May of this year, we also conducted a survey of our clients, soliciting their views on the costs and other implications of the reform law. We do believe that we are uniquely positioned to articulate the law's effect on employer-based health insurance plans. Mr. Chairman, the employer community is the single largest employer of health insurance in America. The majority of our clients want to continue to supply health insurance, but they struggle with the cost and the federally imposed complexity of plan administration. Health care reform adds to, rather than mitigates, the cost and complexity of providing employer-sponsored health insurance. For example, the Federal Government requires 52 separate notices, disclosures, and reports to enrollees in health insurance programs. 19 of these, and that's just so far, were added by health reform. This frustrates our clients immensely. They question why, during a recession, when employers are struggling mightily just to stay afloat, much less supply this valuable fringe benefit, Congress would make the process more expensive, more onerous, and more complicated. They tell us the additional cost, complexity, and uncertainty wrought by the law affects their ability to hire additional workers or even retain current full-time employees. Clients find it difficult to plan strategically in light of the uncertainty the law brings to their world. One client in our survey summed up the view of many regarding this law, calling it a job killer. Nearly 20% of our survey respondents said they will consider terminating their group insurance plan in 2014, and they cite cost and complexity as the main reasons that they will consider doing this. In our survey, 63% of respondents said they were concerned or very concerned about the cost of the law's immediate benefit mandates. 71% said they were concerned or very concerned about the cost of implication of the pay-or-play mandate on employers, and 60% about the cost of automatic enrollment. Our actuarial modeling of over 250 middle-market clients validates our clients' concerns. Taken together, the law's immediate benefit mandates, waiting period limits, and auto-enrollment requirements on average add 6.3% to our clients' health insurance cost on top of current health insurance inflation, and it's more in certain industries. The employer pay-or-play mandate in 2014 poses additional problems for employers because of the sizable difference between what most employers pay to supply coverage for an employee and the penalty they would pay if they terminated coverage. The vast majority of our clients have a significant financial incentive to exit the group insurance market in 2014. On average, our clients outside the retail, restaurant, and hospitality industries would save 44% off their current health care budget by terminating their group plans, leading nearly 20% to tell us they would consider doing just that in 2014. About 80% of our clients indicate they don't expect to consider terminating coverage, but the reason they give is the perceived need to provide health insurance to attract and retain clients. We are concerned that the moment they see they don't have to offer competitive health insurance, that 80% number could drop significantly. This would result in huge increases in exchange participation and subsidy liability for taxpayers. 17% of our survey respondents said they would work to avoid play or pay penalties by substituting more part-time employees for full-time workers. 44% said they will reduce the employer subsidy toward employee coverage, and 43% said they will reduce the employer's subsidy towards dependent coverage. That does not bode well for working Americans. Thank you for the opportunity to appear before you today. In assessing the impact of this legislation, I urge you to place yourselves not only in the shoes of those Americans who need and deserve access to affordable health care coverage, but also in the shoes of the employers who supply valued coverage to 160 million of us. As one of our survey respondents wrote, "This plan doesn't fix the health care problems, but shifts the burden to employers to take care of the issue without any type of assistance in covering the increase in costs." We look forward to answering your questions and working with you to address the issues raised by our employer clients. Thank you.
Thank you, Mr. Brewer. Mr. Gardner.
Good morning, Chairman Gowdy, Ranking Member Davis, and members of Subcommittee. Thank you for the opportunity to testify on the #1 problem facing small business, the ever-rising health care costs. I'm Terry Gardner. I'm Vice President of Policy at Small Business Majority. Small Business Majority is a national nonprofit small business advocacy organization founded and run by small business owners. I myself have spent most of my career, was kind of shocked to add it up and to think I started my first business 40 years ago as a self-employed commercial fisherman in Alaska, where I grew up. Went on to create a seafood processing company that grew and over 22 years. And when I retired, I had 1,000 employees with over $100 million in sales, exporting to 22 countries. Other members of our senior team at Small Business Majority are also entrepreneurs. And as business owners, we're well aware that government policies can take either of two courses. They can help promote job creation and help promote business. And at the same time, they can be other laws and regulations, in our experience, it can definitely be a burden on business and discourage growth. So we're not unaware of those situations from our own personal experience. But the problem facing small businesses, those 22 million self-employed out there, 1/3 of who don't have coverage, and the nearly 6 million small businesses with under 100 employees, they keep saying that health care costs, ever rising, are their #1 problem. We've done a lot of polling, scientific polls across the country, national and in many, many states. Between December 2008 and August 2009, 67% of respondents said reform was urgently needed to fix the economy. An average of 86% of those companies who do not provide coverage said they couldn't afford it. 72% of those offering health benefits said they were struggling to do so and cited the cost as the reason they were struggling. So this simply, paints a status quo that's unacceptable for small business. We've also done some economic research that was conducted by MIT economist Jonathan Gruber to look at the scenarios. Our country then and now does face alternatives. We could do nothing about our health care system, or we could try to change it so it works better. So we looked at those alternatives. Doing nothing is a job killer. The Gruber's projection showed that over the next decade that small employers would pay $2.4 trillion in health care costs. There would be a loss of 178,000 jobs. There would be negative impacts for employees, too, $834 billion in reduced business wages and a reduction in profits. So doing nothing is not a great scenario. So that moves us to where we're at now, where we have the Affordable Care Act as the law in the country that we're here today discussing. Projected by CBO that it would have the benefit of reducing the Federal deficit by $200 million over the next 10 years and $1 trillion over the following decade, which is a positive for all businesses and all citizens. But the point for small businesses is to reduce their costs so that they can keep more money in their bank account, which is what they use as fuel to expand and create jobs. And there's many provisions in the ACA that are going to help small businesses, many of which do not offer health coverage now, and many self-employed simply can't afford it. So there's new mechanisms here in the ACA, tax credits for small employers. There are health insurance exchanges that will be established in the 50 states. Some states have already moved forward, Massachusetts, Utah. We have exchanges that's been in effect for 15 years in Connecticut and provides a lot of insurance to small groups. So we know there's problems. You've heard about some of them here today with the ACA. We're not here to say they're perfect, but we think focusing on these and fixing them would be a better course of action than going backwards. Thank you.
Thank you, Mr. Gardner. I'll recognize myself for 5 minutes questions. I will direct this to the first 3 witnesses to my left. What should the Federal Government do or stop doing to enable you to create more jobs?
Turning my speaker on or my microphone on. The government now is doing a lot to create a high degree of uncertainty in the business community. We're uncertain about what tax rates are going to be. We're very uncertain about health care costs, and the only thing we're certain about is that they're going to go way up. We're uncertain what's going to happen with energy, with the EPA. We're uncertain about unionization with the NLRB. There's a lot of uncertainty out there. When businesses are going to invest and create jobs, they generally want to come up with a 5-year business plan, which shows you get a return on your investment at about 20% a year, and at the end of 5 years, you've gotten a return on your initial investment. If you can't do a forecast because you don't know your costs, you don't know your expenses, and what you do know you don't like, you're not going to invest. And American businesses are stalled. I think that chart shows it up there. People are not investing because they can't show a profitable return of their investment. And if you think your expenses are going to go way up and you have 2 choices on what to do with your money, retain it so you can cover your expenses or invest it to grow and create jobs, you're going to hold on to your cash. So we're not seeing the kind of investment we should be seeing, and if the government would just work to create some certainty, some positive certainty for the business community, I think you'd see an explosion of job creation.
So is it fair for some of us like to say that our tax, regulatory, and litigation structures create the uncertainty that stifle job creation? Is that a fair statement? Tax, litigation, regulation.
I think that's a very fair statement.
Mr. Payne, what employees, what categories of employees are most likely to be adversely impacted by the implementation of Obamacare?
Well, at our company, it's going to impact all of us. It spreads completely out through the organization. We can't necessarily cut sections out. We're kind of a complete pie. So, if you cut part of it down somewhere, you have to equally pull out the support structure that goes with it across the lines. And so it's going to impact every area that we're involved in. I agree with everything that was just said. In our case, our plants that we put in are about $1 million investments. We add people less than 50. Generally, we pump about $1 million in payroll into those plants on an annual basis. We cannot add any more plants not knowing what the cost structures are going to be going forward. Will we cut people? We're trying to cut people all now. So it has an impact on all of us.
Mr. Morey, the President famously said that if you like your health insurance, you will be able to keep it. With respect to your company, is that statement true? We'll get you to turn your mic on.
Back to the comment that was made later about uncertainty, that's one of our great concerns. We would like to offer our private plan essentially to our staff members. They're very important to us. We want to see that they're, that they have a great plan and they're well taken care of in that area. But it's unclear to us whether or not that's going to be the case or not. And when we look at things like the burden of the seasonal issue that I've been speaking of and what that means to us in terms of cost and compliance, that endangers our ability to be able to provide the coverage that we're providing now.
Mr. Girdle, I've only got a little bit of time left, so if I can get just a yes/no response from you on whether or not you support some other initiatives that might solve some of our health care woes. Do you support incentivizing health savings accounts?
I'm not sure what you mean by incentivizing.
Through our tax structure.
Yeah.
Flexible spending accounts.
I think they work too.
Do you support creating the same tax treatment for employees who want to purchase health insurance as the employer has?
You mean self-employed?
No, I mean an employee. If they want to purchase health insurance on their own, should they enjoy the same tax benefits as employers?
Yeah, well, this is a particular problem for self-employed. Now, we have a one-year provision that needs to be extended that self-employed don't have the same tax.
I'm not talking about self-employees. I'm talking about individual employees, individuals who want to purchase health insurance. Should they have the same favorable tax treatment as employers?
Yes.
Medical malpractice reform. Does your organization support that?
Yes, and we did during the ACA. We're on record as supporting that.
Thank you. My time has expired, and I will recognize the gentleman from Maryland, the ranking member of the full committee, Mr. You want me to go to Mr. Davis? I will recognize the gentleman from Illinois, the ranking member of the subcommittee, Mr. Davis.
Thank you very much, Mr. Chairman, and let me thank our witnesses. And I must say that I was seriously impacted by all of your businesses, your courage, your determination, the tenacity, the fact that you've been able to make conscious use of yourselves to build strong businesses and provide opportunities for other people to work. Mr. Gardner, can I ask you, have you ever had any employees who didn't earn enough money to pay for health insurance?
Yes.
Mr. Brewer, have you ever had any employees who didn't earn enough money to pay for health insurance?
Yes, sir.
Ms. Braden, have you ever had any who didn't earn enough to pay for health insurance?
No.
No?
No.
Mr. Morey, have you ever hired anybody that didn't make enough money to pay for health insurance? You have? Mr. Payne, have you ever had any who didn't earn enough?
I'm not sure that I know the answer to that because I don't know what cost would be, but I've got people that have turned down insurance before because of cost.
Mr. Pudsey, have you ever hired anyone who didn't have enough money when they got through to pay for health insurance?
Well, we have a number of part-time employees who may not have enough, but we do offer them a very low mini-med, affordable plan. I really can't say that I've ever done any research on that, but we probably have part-time employees who couldn't afford the plan.
Well, let me ask you this question. Can you think of anything in life more important than being healthy?
No. Well, your family, belief in God.
That's a good point, especially belief in God. I happen to be a practicing Christian. And I notice at my church that everybody wants to go to heaven, but nobody wants to die. I mean, that sort of reminds me of Frederick Douglass one time when they were talking about the abolition of slavery. And every time somebody would come up with a way to do it, there would be a reason why it couldn't get done. And he ended up saying that there are those who reminded him of people who might have wanted the rain but without the thunder and the lightning, or they wanted the crops without plowing up the ground, or they may have even wanted the ocean without the roar of the mighty waters. And so it seems to me that there are things that we want to happen, but somehow or another we can't bring ourselves to the point of doing what's necessary. Do we believe in tax credits? Let me ask, have any of you ever used tax credits in any facet of your businesses?
I'm sure that whenever they're available, we use them.
And so if tax credits are made available for small businesses to help provide health insurance, for employees, that might be one way of helping some of those individuals who had no other way of being insured.
Yeah, I think it would, Congressman, but I will tell you that we offer all of our employees health care coverage and inexpensively, and I think of our 17,000 part-time employees, about 6% choose to take the health care coverage over the cash. So it's 94% would rather have the job and the compensation.
Oh, I would certainly agree, and I guess when you say small business, it would be kind of difficult for one to suggest that your company was a small business. I mean, by pretty much any standard.
Yeah, but Congressman, we deal primarily with larger employers, but I fundamentally believe that the same advantages that are available for our larger employers ought to be available to smaller employers as well.
Well, let me ask you, do you believe that health care should be a right and not a privilege?
That's a difficult question. We've created a system where people don't have to buy health care to get health care. I'd certainly like to believe that it is a right. I think there are fundamentally some better ways that we could go about some of this. And I will tell you that our firm has been historically pro on health reform. It's exactly what you said. It's just the form that takes.
Well, see, I think at the base of the discussion is what we believe in terms of individuals who live in our society. Ms. Braden, you were about
I'm the person that actually deals with the small businesses I think that you were referring to. And on the tax credit that we have on the floor right now, the $25,000, or $25,000 of income, and you could do this, I don't have but a handful of employers out of my group that can actually take advantage of that. And those employers are all nonprofits, so they're taking advantage of it against their FICA taxes. So that piece of it I don't see. As far as health insurance being a fundamental right, so is being healthy, and people have a responsibility to that. And we're not seeing that in any of our small groups. We're not seeing folks going out and actually working to be healthy, which would then bring down the health insurance costs.
Well, I think we could debate that a great deal, but my time is up. Now you're back.
I thank the gentleman from Illinois. Would now recognize the gentleman from Tennessee, Dr. Desjarlais.
Thank you, Mr. Chairman, and thank you, panel, for appearing here today. There's so many questions and so many directions I'd like to go today after hearing your testimony, and I don't think I've ever sat through a hearing where the testimony was almost so self-explanatory that a lot of the questions I had to ask have already been answered to some extent. Mr. Payne, you had laid out 3 options for your company in terms of health care. And when we discuss Obamacare now, sometimes we get chastised for using that term, Obamacare. It is known as the Affordable Health Care Act. After laying out your 3 options, do you agree that it's affordable?
It's not affordable to us. The way it's structured, and talking about the credits for small business, we consider ourselves a small business, and some of the exemptions for less than 50 employees really hurt us. But we don't get those exemptions, yet we're competing against the people that do. So it ought to be more of a level playing field. But to answer your question, no, it's not affordable. Is the current system good? I won't say that the current system is good, but we're surviving and making a profit and growing and hiring people with the current system, dealing with year-to-year increases in the programs, dealing with through the insurance companies. Under the new program, it could be that we may not have a business to grow. So it's definitely changed.
Thank you. Mr. Gardner, today the Center for Medicare and Medicaid Services actuary stated health care costs will double by 2020. Considering President Obama passed Obamacare to reduce health care costs now, will your business be able to cope with these increased health care costs?
Well, fortunately for me, I've reached that retirement age and don't own a business today.
But you represent several
Yes.
businesses.
And I think that there's more that needs to be done about cost containment. I think that was very evident during the whole debate of the Affordable Care Act. More needs to be done, and we've faced these kind of racing costs. If you look at a graph, as I did when I retired and got into health care, these costs have been going up like a rocket for decades.
Okay, but yet we as a Congress, I wasn't here at the time, but we then passed massive sweeping health care reform that we didn't ask for, we don't want, and apparently we certainly can't afford. So, here we are moving forward with what did then Speaker Pelosi say? We need to pass this bill so we can find out what's in it. From what I'm hearing from this panel up here today, I doubt that anybody sat down with business folks like this and listened to what they have to say before this bill was constructed. And I can tell you as a physician, I don't think they sat down with health care professionals either to see whether or not this was feasible. So now we have this problem. You're sitting here wondering how we're going to continue to employ people in this nation. The greatest crisis facing our country right now is unemployment and spending. And everything about this bill that I can see is nothing but driving up costs and government spending. And frankly, government spending is nothing more than taxes. Our government doesn't generate any revenue outside of taxes. So anyway, I wanted to ask a few more questions. Mr. Brewer, the CBO has estimated that as many as 12 million employees could be forced into the exchanges. Do you find this number accurate?
No. I think the CBO is made up of smart, hardworking, well-intentioned people. I don't know how much interaction they have with people who have employees and payrolls and have to make these decisions, but I can tell you we dealt with about 3,000 of them last year and the year before that and the year before that. So I think the incentives that we uncovered in our actuarial studies as well as the information we got as a result of our survey would suggest to me that I don't know how many renewals CBO did last year, but as I said, we did about 3,000, and we're coming to a much different conclusion based upon that information.
Okay. Thank you. Mr. Putzer, will the health care law lead you to automate more services or replace full-time workers with part-time staff?
Absolutely. We will, people who are currently full-time employees, we will have to make part-time employees, which means they'll have to have 2 jobs to get a full-time salary. We will automate positions such as the cashier. Right now they have those ordering kiosks like the ATM or what you see at the gas station where you pay with your credit card. We haven't used those because we like the personal touch and they're a little expensive, but once you implement this health care bill, I think those kiosks are going to become much more desirable. So we'll be reducing labor force and also automating positions.
Okay. Well, I'm out of time, but just quickly, do you believe most of your workers prefer a job or government health insurance?
Absolutely, and I think the fact that only 6% of the 17,000 part-time employees we offer insurance to take it would be a very strong indication that that's true.
Thank you, and I yield back.
I thank the gentleman from Tennessee. The Chair would now recognize the gentleman from Maryland, the ranking member of the full committee, Mr. Cummings.
Thank you very much, Mr. Chairman, and I want to thank you for calling this hearing. And as I was sitting here listening, I could not help but think about my days as an employer of a small law firm, and we provided insurance for our employees. And it took away from our profit, but we did it. We did it because we believed that it was the right thing to do. There were only 3 lawyers, but we had about 5 clericals, and we did it. And let me also say this. I'm not here to chastise anybody about anything, but I take great offense when I hear the word Obamacare. There is no such thing. Members of this Congress voted for this legislation, and many of us have very strong feelings about it because we are seeing people in our districts without insurance. We're seeing people literally die. So it's a very serious thing. And so there has to be a balance here, and I appreciate your comments because I can look at this thing from a small business employer for 20 years, but I can also look at it from the standpoint of a legislator who have seen the results of people who end up in emergency rooms, and we're paying a lot more to emergency room care, and we all end up paying for that. But you said something, Ms. Braden that I found very intriguing and very interesting. And correct me if I'm wrong. You said something to the effect that you saw people that were not, you said not seeing anyone trying to be healthy. What did you mean by that?
Well,
and how do you know that?
Because I deal every day with the people inside the companies that I work with. Thank you for asking. If you look at people and healthy, we're not talking health insurance. When you go to the emergency room, you're receiving health care. And we sort of have taken those two subjects and melded them together. And really, I think what we need to do is separate them apart. If you take health insurance, what it does is support people in health care. If people are getting health care, that's one thing. But if they're not taking care of themselves, then they're driving up the cost of health care, which does drive up the cost of insurance.
I guess what I'm saying to you is that there are a lot of people who, first of all, part of the Affordable Care Act was one of the driving forces was to keep people well. And another thing that we were trying to do was to try to drive down the costs that these insurance companies were charging for these policies. It's a hard thing to control.
Well, and insurance is really easy. It's premium paid in, claims paid out. So if you want to control health care costs, you've got to control claims paid out. I mean, insurance isn't hard. It is a pass-through. The reason we have insurance was to make deals with doctors and hospitals at a reduced cost so that every individual company didn't have to go do those negotiations.
I understand, but did you realize that when we were going through this, there were insurance companies that literally out in California went up on their rates 30%, 30%.
When I looked at some of those policies, because we heard about Blue Cross Blue Shield out there, and I called some of my folks out there that I work with, there was one policy that they said 59%. Well, that was 5 people on it, and the policy was rich, very rich, and had been constructed over 20 years ago.
Well, that's one, but I'm just saying, they went, I'm talking about over, well, I don't want to get caught up in this, but what I'm trying to say to you is that there's one thing we're trying to, when we talk to health care insurance people, it's not as simple as you're making it sound. In and out. That sounds nice, and if that was true, that would be accurate. That would be nice. But part of the Affordable Health Care Act was to try to say to these companies that were spending, say, for example, insurance companies spending 35% on overhead, 40% on overhead, that they had to control that, and they had to put more into medicine. Another part of the Health Care Act was to try to address this thing of pre-existing conditions. You know, there are people who, and God forbid it happen to any of you all, you get cancer, scared with cancer, and if you have a gap in your insurance right now, you'll never get insurance. I've had people in my family in that situation. If they had $100,000 to pay for insurance, they couldn't get it. So I think we have to be careful when we're looking at this, because there are parts of the bill that you might like, and there are other parts that you might not like. But I think, again, we've got to be careful. Well, again, we're trying to bring down the costs so that people will stay well, because we're going to pay one way or another. I realize I've run out of time, but thank you, Mr. Chairman.
I thank the gentleman from Maryland. Chair would now recognize the distinguished gentleman from Arizona, Dr. Gosar.
Thank you, Mr. Chairman. I am a health care provider. I'm a dentist, and I'm a small businessman. So there's theory, and then there's application. So a lot of things look great on paper, and I know every single one of you hear it in your board meetings every day. But then there comes the reality of how does it actually be implicated. And Mr. Gardner, I know you cite and model, and you show that small businesses actually benefit from government takeover of health care. I prefer that term because I can tell you and back that up, that that's what it is. However, the model assumes much smaller growth in health care costs, an assumption both the CBO and CMS have rejected as being highly implausible. And I think we've seen a lot of that discussion and looking back at equations and numbers making that. Instead of relying on an academic model and with faulty assumptions, how many businesses are you aware of that are enthusiastic about this health care plan?
Many. And if we could have some of them call you and or write you if you'd like.
Oh, I'd love to. Can you pull off a couple off the top of your head?
Yeah, I think some of them were cited in my written testimony, and I'm just thinking of one right here in the greater metro area, Mike Bray with the hobby shop. He's come on his own and testified.
How about something in Arizona? I don't like examples in the Beltway. How about something out in Arizona?
I don't have one off the top of my head in Arizona.
I'd like to know. Mr. Brewer, do you think that you are real happy with the assumptions based off what I just asked Mr. Gardner?
You mean the CBO assumptions?
Mm-hmm.
No, not at all.
Is it going to create jobs?
No. And everything that we see indicates the incentive to a cattle drive to the exchanges.
Oh, I like that. Now, I'm going to skip you for just a second because I'm coming back to you, okay? Mr. Morey, how about you?
I do not see the opportunity for job creation out of this bill, no.
How about you, Mr. Payne?
None.
How about you, Mr. Pudzer?
It's a job killer. It's not a job creator.
So my colleague on the other side talked about the administrative costs. Mr. Putzer, tell me where the administrative costs many times are linked. Is it in less government regulations or more?
Less government regulation will drive down administrative costs.
Thank you, Mr. Payne.
It's the same thing. Government regulation costs a lot of money.
Mr. Morey.
I would echo those comments.
Yep. How about you, Mr. Brewer?
Oh, certainly.
I'm not being disrespectful because I got something special for you. Mr. Gardner.
Less is more.
Okay. I love that. So my colleagues on our side have been talking about, or the opposite side have been telling us that the Republicans have been never proposing any jobs. And what we're really trying to do is get to the core matter of it. We're not trying to put a Band-Aid on it. We're trying to streamline the red tape. Mr. Brewer, you made a comment of a cattle call, okay?
Cattle drive.
A cattle drive, cattle call. We're going into a...
They're different things.
Well,
I'm a Texas boy.
I'm from Wyoming, so you use one to get to the other.
Yeah.
Okay. And so, Ms. Braden, you made some wonderful comments, and that is there is a responsibility. I am a believer we need reform, but not the reform I saw, okay? Because you hit it, and that is there's personal accountability, personal responsibility. And I do believe there was a little company in Iowa that actually had a concept like this, if I'm not mistaken, that what they basically did is they invested in the employee, and they said, listen, we're going to make you see your family doctor, and that preventative service, whatever they come up with, we're going to give you time during that workday to be able to do that, but you got to stay on that preventative model. And if I'm not mistaken, and then they made another caveat. They said that as long as you stay on that caveat, we'll pay 100% of your claims. They said if you fall off, you're going to pay 25% co. If you fall off again, it's 50% co. Fall off a third time, it's 75% co, and so forth and so on. And guess what?
Everybody went to the doctor.
Everybody went to the doctor. And guess what? You died with that company. What a job creation that was. Because what happened is you had investment from the patient and the employer and the health care benefit all the way across the board, minimizing the red tape. So thank you very much for making sure that we understood that we're not here about job stymieing. We're here about building jobs on reducing red tape. Thank you.
I thank the gentleman from Arizona. Chair would now recognize the distinguished gentleman from Missouri, Mr. Clay.
Thank you, Mr. Chairman. And let me, too, welcome two of my friends, former colleague and friend, the former Senator Jim Talent from my home state of Missouri. Thank you for being here, as well as my friend, Mr. Puzder, who runs a significant operation out in Missouri. Thank you for your testimony today. Let me start out by saying that the Patient Protection and Affordable Care Act is the law of the land, and it's a good law. And like any law, it could be improved. However, my colleagues on the other side of the aisle are not interested in honestly examining the positive and negative aspects of the law, and I think they're just interested in repealing it and scoring a political victory over President Obama. This health care reform law is good for Americans, it's good for businesses, and especially small businesses. And it's very good for young businesses, which are actually the ones that create the most jobs. And I'm so glad to hear the phrase job creation. First time I've heard it in over 6 months in this committee. Some have raised concerns that businesses won't be able to afford compliance with the ACA. 98% of employers will be exempt from the insurance mandate, and 95% of the businesses that are not exempt already offer health insurance to their employees. This misleading premise of this particular hearing is that the ACA hurts so-called job creators. Now, let me start with Mr. Gardner. Thanks to the ACA, starting this year, consumers will receive more value for their premium dollar because insurance companies will be required to spend 80 to 85% of premium dollars on medical care and health care quality improvement rather than on administrative costs. If they don't, the insurance companies will be required to provide a rebate to their customers starting in 2012. This provision is known as the medical loss ratio. Mr. Gardner, do you believe that the combination of the medical loss ratio requirements and the shop exchanges will make it easier for employers to offer quality, affordable health insurance to their employees?
You know, in terms of the MLR, we've looked at the data. There's a lot of states before, the ACA passed, and currently we're under those rates in those states already, and the world didn't come to an end. So we just see it as this means it's feasible for insurance companies in other states to do it, and the 22 million self-employed who buy insurance today in the individual market was certainly going to be protected, and the 4.8 4.8 million companies that have under 10 employees who are paying a lot more for insurance than other businesses that have more than 10 employees are going to benefit from this too, because they're in the small group market. And we think the exchanges are really the critical part for making, putting small businesses on a level playing field. They don't have the option to really be self-insured if you're 10, 20 employees, 50, where the bulk of small businesses are. And these exchanges can work, and they've been proven to work. And we think that's going to be the driving force for making it more available and more affordable for small business.
Thank you so much for that response. Mr. Puzder, I've heard your concerns about providing the nutritional information for the products that you sell. Other than that requirement, do you think that this law will help shave cost on health care for your employees? And when I say shave costs, will it help reduce the cost of prescription medicines? Will it make the delivery of health care more efficient for your employees?
I don't believe that it will. As I said early on, I'm not a health care expert. I can tell you how it impacts our company from a financial perspective. But right now, I went into our restaurants when the health care debate was going on, and I said to some of the employees, why do so few of you buy this insurance that we offer that's so inexpensive? And the response was, well, Mr. Puzder, we get it for free at the emergency room. So I don't know how much better they're going to do than free.
Well, that's why we are trying to connect people with health care providers and to cut down on the cost of people showing up at the emergency room for a cold.
I agree with that. I think that the employee is not going to be positively impacted, but there should be something done to cut those emergency room costs. You got a very good point there.
Thank you, and I yield back.
I thank the gentleman from Missouri. With the indulgence of our panel and my colleagues on both sides, we would like to have a second round, which we sometimes refer to as a lightning round. My colleagues do not need to feel the need to take their full 5 minutes if they don't want to. But I will start with the distinguished gentleman from Tennessee, Dr. Desjarlais.
Thank you, Mr. Chairman. And thank you, Mr. Clay, for shortening the term to HCA, or Health Care Act, and dropping the affordable. That's a little easier for me to palate. But you mentioned that this bill was brought about, and it's the law of the land, and you were glad to hear us mention job creation. And I think we're all here today talking about the detriments to job creation. And I think that point has been very strongly made. And in terms of the last question on shaving cost, I worry more as a physician about shaving quality, because we are trying to increase the number of people into a health care market with really no means to pay for it. But that's not entirely true, because our friends on the other side of the aisle believe that Obamacare's taxes, which include the employer mandate tax penalty, an increase in the Medicare Part A tax, a new tax on investment income, a new tax on health insurance providers, a new tax on drug manufacturers, and a new tax on medical device manufacturers are paid by firms out of their massive profit buckets. Moreover, they believe taxes only impact the top 2% of taxpayers. Based on your experience, is this a fair portrait of reality? And I'll just open that to whoever would like to grab it.
No, it's not. There's no way you add all those taxes in and reduce the cost of health care, period.
And I'd like to, Mr. Cummins had mentioned how his firm had been profitable, Congressman Cummins, how his firm had been profitable. They gave those profits into paying for insurance. I think part of what we're all saying here is we can take those profits and put them into insurance. But if we do that, we can't invest them, grow our businesses, and create jobs. So it's that we're not really in conflict on that, but you can't. Like I said, there's no corporate pot of gold to go to pay for this stuff. We've got to take it from someplace, and it's going to come from growth and job creation.
So again, as you stated, it's a job killer.
A job killer.
And does the rest of the panel, for the most part, agree with that?
I think part of the solution to getting more dollars in the system is that everyone, as has been talked about here, every citizen has to be responsible. And I think that's why there was an individual mandate put in. You can't have a bunch of people who don't pay but yet can show up and get coverage and doing what people are talking about here. So I don't think anybody's ever looked at this and said that you could have a sustainable health care system and not have everybody in the system and everybody paying their fair share.
Okay, so basically forced health care?
I don't think you can have a system with freebies.
Okay.
It doesn't work.
There's always been a big debate about exactly who was uninsured in this country. I heard numbers early on that there was 30 million uninsured. We've asked people to define who those 30 million were. Apparently up to half may have been here illegally and not eligible for health care. Perhaps half of the remaining 15 million are folks that would qualify for Medicare but just haven't signed up. And then the other half are some of the workers that are young and bulletproof and just opt not to have health insurance. So in essence, this new law of the land that was imposed upon people against their will, and clearly the majority of people in this country still do not want this, is what we're stuck with at this point. And I think that's why we're having hearings to show the detriment of this health care law and what it's going to do to impact the economy, and yet not really resolve the health care problem. It was poorly conceived. It was passed in the middle of the night, and people maybe have forgotten about how that occurred. But let's get back on to some more questions. Mr. Putzger, did Hardee's need a government mandate to add salads to its menu?
No, we've actually, Carl's Jr., we've had salad since the 1970s. Used to have salad bars.
Okay, a government mandate to add turkey burgers?
No, not at all. They tested well and sold well.
Okay. So you're managed to do things to help keep people healthy without government mandates.
We love it if people buy healthy products. We're happy to sell them.
Right. And so now Federal mandates of sign changes to help people understand what it is they're buying. Do you think that's going to impact their habits, or do people just kind of do what they
Well, no, I don't think it is, other than, well, there have been a number of studies on this, and I've included them in my written testimony that show that, in fact, that has no impact on people's eating habits. In fact, anecdotally, we've noticed in some of the restaurants where there's already menu labeling required, people think that fast food has more calories than it does, and they actually end up ordering higher calorie products once they see what the caloric content actually is. So it's been a very interesting experiment so far that clearly hasn't worked.
Okay, my time is out. I yield back.
I thank the gentleman from Tennessee. Would now recognize the gentleman from Illinois, the ranking member of the subcommittee, Mr. Davis.
Thank you very much, Mr. Chairman. You know, I was thinking when you walk into my home, my wife has a sign that says, "Welcome to the Davis household." And then it says, "Please know that the opinion of the husband is not necessarily that of management." And I am so pleased that opinions don't necessarily manage what we do all of the time. I am amazed at some of the things that I hear. Job killer. If you create an opportunity for more than 30 million people in this country to have health insurance and go to the doctor on a regular basis and stay out of the emergency rooms of hospitals and to live longer, the only business that I could see that gets hurt by this is the undertaker. And he doesn't get hurt too much because eventually he's going to get you anyway. I mean, it takes a little bit longer. Could someone please share with me how creating opportunity for 30 million people, over 30 million, to get decent health care, that creates the need over the next 10 or 15 years for 150,000 additional doctors, for more than 250,000 nurses. Could someone tell me how that kills jobs?
I think I can, Congressman. There is let's just assume that there is this benefit, as you've outlaid it, and it's not. I don't know that it's a health care, if it's a health care benefit or a health insurance benefit, because I think the law requires health insurance. They already get health care. But let's just talk about the health insurance benefit. Benefits have costs. The money to pay for those benefits has to come from somewhere. Our business makes a profit. All of that profit is reinvested in the business. When the profit is reduced, you invest less in the business. If the profit is eliminated, you have nothing to invest in the business. If you don't have anything to invest, you can't grow and you can't create jobs. So there is a benefit, and I'm not here to argue about that. I just want you to know that there is a cost associated with the benefit, and I think the businesses that are at this table here are telling you,
but if
in some instances, it may put them out of business.
If I am dead because I couldn't get health care, can I come to your business?
No, but there'll be somebody to replace it. Congressman, your passion is evident and commendable, and your conviction is commendable. But he's right. Anything you do that erodes profits in an organization impedes their ability to create jobs. And as much right alongside the cost implications of the Affordable Care Act are the administrative complexities that it makes it easier for an employer just to throw up their hands and say, heck, I'm out. Let's send these folks to the exchanges, and then they can be subsidized by the taxpayers. I'm all for everybody having health care. I totally agree with you on that. I think we disagree fundamentally on how you get there.
But see, I think that the realities are, if you even just deal with the question of fairness, if you ask a bird, is it fair for birds to eat worms, and you turn around and ask the worm the same question, chances are you're going to get a different answer. And so if you ask the thousands of employees in my congressional district who provide health care for people all over the world, if somehow or another their ability to provide these services will drive down jobs or take away jobs, they'd probably disagree vehemently.
I'm sorry, that's not what our survey results tell us.
They would disagree. Well, ask the 21 hospital administrators in my congressional district if they would agree.
Congressman Davis, there's another important aspect of job creation, and that relates to job lock. And job lock has two impacts. One, employees at a company who don't want to leave because they go somewhere else, maybe they wouldn't have health coverage, and it's very vital for they and their family members. The other is, who's going to start those new companies? And those are people in the workforce working at a job, and they go through this same system. And the harder it is for them to see their way to go out and launch, and the first step to be a self-employed person to found a company, and they can't get benefits for them and their family, and they're a responsible person, they're going to stick with their job. So it's more complicated than just surveying existing companies. There's a whole bunch of other factors about who starts businesses and how they grow at the bottom.
Thank you very much, Mr. Chairman. And I certainly agree in terms of our health care delivery system. We have much more of a sickness care system than we do a health care system. So I would certainly agree with you, Ms. Braden, on that point, and I yield back.
I thank the gentleman from Illinois. The Chair would now recognize the gentleman from Arizona, Dr. Gosar.
My colleague, Mr. Davis, really brings it forthright. First of all, life isn't fair, never has, never will be. If you're a business, you should never complain about a profit. That's what you should do. That's what has to happen in order to create jobs and to have the ability to employ more. The other thing that we have to look at is when government impedes itself or impugns itself into any type of parts of our life to the degradation of that industry, we see it flounder. I'll give you a good example. You don't have to look very far with government intrusion in health care to look at the Native Americans. Boy, there's a great employment rate there. 60% of the Navajo Nation, 75% on the Apache Reservation, all because of dictations by government. And why do I bring that up? Well, because this program is based on a flawed system that flawed it from the very get-go, as it demanded that you had to go to the emergency room. You couldn't turn anybody away. You couldn't even ask the questions. Where are you from? How do you look? You know what? You couldn't turn them away. So what we've done is we've restricted care, and medicine did that. I'm happy to say I'm from dentistry. We never went down that road. And the reason I say that is that today, for every dollar spent in dentistry, 50% comes out of the patient's pocket. So they have risk. They find value. That's why you see lots of dentists. Of course, we're not doing so good right now because we don't have a good economy, okay? But there's something inherently right about that. So I kind of want to continue that by saying, you know, in 2014, employers will have to employ with at least the 50-person full-time employees who will face a penalty for failing to provide minimum essential coverage. How is this going to affect businesses specifically or in respect to hiring? Mr. Brewer.
Well, it's going to, people who have 49 employees are going to keep 49. I think there's a fair number of our survey respondents that suggested that they would go to more part-time employees so they wouldn't have to offer coverage. There's no way that helps in their hiring practice.
So what we're doing is we're cost shifting again. We're making it go back to the government so that the government's going to have to streamline them, just like they did in the Medicare rolls, where what we do is we look at the equations and we take away certain benefits so that we set them on Medicaid. This whole system is based on a flawed system. It doesn't work anywhere along the line for job creation. Ms. Braden.
If you really look at what the cost of health care is to an employer, there's not one employer sitting here that can tell you that it costs less than $3,000, which is the fine, per year. Every one of us pays, on an individual basis, pays more than $3,000 for our health care for our employees per year. So now we've got a fine that is less than what we're currently paying. It doesn't take a rocket scientist to figure out what we're going to do.
And let me ask you the next thing. You talked about the administrative cost. A lot of that administrative cost, is it not true that it has to do with tort?
Yes.
Yep. And did you see anything in this bill, any one of them, did you see anything about tort reform in this bill? In fact, it was refused. I wonder why. I guess I'm a dentist, not an attorney. You know, that's where the American people need to stand up and businesses need to stand up. Mr. Morey, how do you see this is going to affect those people, or those businesses that are under 50 jobs?
I see it very much the same way. I would like to mention that the issue of tort reform, to me, is gigantic.
Paramount, right?
I'd like it to go beyond medical into general tort reform, if possible, from our business perspective as well. But, you know, I mean, ultimately, we want to employ people. We want to provide them great coverage. We just don't want, you know, mandates shoved down our throat and how to do it. And ultimately, I think that the free enterprise system does a pretty good job. The marketplace does a pretty good job of attracting. The better employers attract better staff members. The marketplace does work.
Mr. Putzer, you really drive my attention because equations. You know, when you're in business, you're looking at all the parameters and what possibly could do. Have you run all the numbers? Are you comfortable with all the numbers based upon this bill and how it's going to impugn job creation?
No, Congressman. In fact, we hired an expert in this area, Mercer. They're one of the national experts on health care costs. And while their best estimate is that our health care costs will increase $18 million, which is at 150%, the range runs from $7.3 million to $35.1 million. Now, I have to tell you, in any other aspect of my business, if one of the people who works for me came to me with an estimate that ran from $7 to $35 million, I'd tell them to go back and sharpen their pencils. But nobody can figure it out.
One last question, just a quick indulgence. If you have a program in your business that's failing, what do you do?
Terminate it, replace it, try and figure out what the next best thing is.
That's exactly what this law is, and it should be terminated. We should have the guts to say that. Thank you.
I thank the gentleman from Arizona. Would now recognize the ranking member of the full committee, the gentleman from Maryland, Mr. Cummings.
Thank you very much. I want to just reference something that the Dr. Gosar said, and I don't want to. I was meeting with staff, and I may have missed it. So correct me if I'm wrong, that he was glad that dentists can turn away people, unlike emergency rooms, dental care. People pay 50% in average of calls, and they have some skin in the game. Is that accurate? I'll yield to the gentleman.
Did I say that?
I'm just asking you, what did you say about it's okay to
it's not allowed to the federal government, so we're not based upon. We have a good preventative service program because we have lots of family docs out there all the way around.
Okay. Well, I just wanted to just say that I spend a phenomenal amount of my time working on a case called the Diamante driver case. This was a 12-year-old boy who had a tooth infection. He was on Medicaid, and he couldn't find a dentist because he was being turned away. 12-year-old, and this was 3 years ago. And so, because a dentist would not accept him, and this was in Maryland, my state, the infection from a $80 tooth decay problem, it would cost $80 to treat it. He died, 12 years old, because a dentist turned him away. And they spent $250,000 trying to save his life at the end. And so, you know, I guess with regard to dental care and care, period, I just say that our country is better than that. We're better than that. And I understand, believe me, to all of you, I understand what you're saying. I understand business, it's hard being in business. For you all who have your own businesses, a lot of people don't realize what you go through. They don't realize all the folk you got to deal with, the IRS, you got to deal with making sure the lights are on, you got to make sure if you got grass, you got to make sure the grass is cut, everything. You got to pay for every toothpick, every pen, every pencil. Got to make sure employees are okay. You got to deal with absenteeism. You got to deal with all kinds of stuff. But at the same time, I think that, we have to also balance that if we're talking about our people, of course, will make our businesses go. And if they are not healthy, that's a problem. That's a real big problem. And no, there are those that may not see it as health care and as a right. I still happen to think so. But I do believe that when we get to a point where we feel that it's okay to, if I'm a skilled lawyer and somebody comes in to me and they've got a problem, but it's not. That's a little different because I'm talking about life and death. That's different. But if I have a skill and like the doctors in my state, not in Arizona, but in my state, who turned this little boy away, and I'm talking about a whole lot of them that turned him away. And you die at 12. I don't know how many you all have children, but you get a kid that dies at 12, you don't forget it. And so what we've done is we spent a lot of time. I spent a phenomenal amount of my time trying to make sure that never happens to another child in our state again. As a matter of fact, because of Diamante Driver, we have now been able to take Maryland from one of the worst states with regard to having dentists who work with kids on Medicaid to one of the top, I think it's either #1 or #2 in a matter of 2 or 3 years. And so the reason why I mention that is because my staff had mentioned to me, like I said, I was with a staff member, and that statement was made, and maybe I misunderstood or misquoted. I'm sorry I didn't hear it. But I just want to make it clear that there's something that I think should always be above profit, and that is life, health, and safety. And I think it's a very, I think that's what the Affordable Care Act was about and is about. And as somebody said a little bit earlier, no, it's not perfect. But a lot of its imperfections were because of people trying to satisfy both sides of the aisle to get a decent bill. And it did not come out perfect. It is not a product. It is a project. That means it can ever get better. So with that, I yield back.
I thank the gentleman from Maryland. My father is a physician. The only two things that kept me from following his footsteps were math and science. If it weren't for those two, I might have become one as well. And I was sitting there while Mr. Cummings was talking, who's one of the most eloquent members of Congress and somebody that I have a lot of personal affection for. I remember always being the last ones to leave church because folks wanted to ask my dad questions. I remember holidays being interrupted. But the thing I remember the very most are the people who would call at night and say, my kid's been sick all day, can you come see him tonight? That's frustrating when somebody's been sick all day. Why you didn't take advantage of the office hours? Why you waited until the evenings? And my mom would say, why don't you charge more? And he never would do it. So my question to you all is, what is the role of personal responsibility in our health care system? Do we incentivize the right conduct? And we've got all these different models from what we have now to what's perceived as radical, which is decoupling health insurance from employment. It's perceived as radical, but that's the way we existed up until 1944. We didn't get our health insurance from our employer. We got it ourselves. I'm not smart enough to know the difference between a right and a privilege. I just know this. Personal responsibility has to be part of the equation, or we're not going to make it as a republic. So I would ask you this in conclusion, and I'll let you go from left to right, give you all the last word, although we've only got about 3 minutes, so apportion it accordingly. What is the role of personal responsibility, and how can our country better incentivize the right conduct and penalize the wrong conduct in our health care system?
When you said right to left, does that mean you're starting with me? I know, is your right or my right?
Your right to left, my left to right. I always like to start on the right.
Okay, I guess it's me.
Okay, you got 10 seconds.
Yeah, I think private enterprise and state governments are the best place to make determinations as to health care. I think there are many things that the Federal Government could do that would contribute to a better health care system. I don't know if health care is a right or not, Congressman, but I know it's the law. I know an emergency room cannot turn you away. What we're talking about here is health insurance, not health care. Health care people get now. This is why they don't take up our offer on health insurance when we offer to pay even 60%. They're getting health care. This is about health insurance and how you allocate those costs. The way they're allocated now, they will destroy our ability to create jobs and prosper. That doesn't mean that profits will go down, but profits are what we reinvest to grow. And if we can't reinvest to grow, we can't create jobs and we can't create prosperity, which is what American business has done for over 200 years.
I agree with that completely. I think there is some personal responsibility that has to go into the medical cost. I agree with the skin in the game program. Years ago, in programs that I was in, you had to pay for the coverage, turn it in, and get reimbursed. Well, I understand people may not have money to pay to start with. In our districts, every plant that I've gone around and checked, our people get medical coverage. It's there. Our property taxes, everything's paying for it already. I haven't had a single complaint of a person in our organization that comes back to us and says that, hey, we've got an employee or somebody in their family that's got a serious problem. We don't have that problem at all. It's not a question of whether people have the right to have the insurance or the coverage. Everybody wants that for them. There's no question. It's where does the cost lie? In our company, it's throwing all the costs to the employer to pay these new expenses, and where does that cash come from? It's a big burden on companies in the middle, on all companies, I suspect, but certainly on our company. It's a burden that's bigger than we have. It's a problem.
I got about 45 seconds left to split between 4 of you. So, sorry.
Yes. We provide $100 incentive for folks to go get a physical on top of that's already covered in the program. We provide a smoking cessation program that is for both the staff member and for their spouse. These are the kind of things we do to try to help people help themselves. That's where I think much of that responsibility lies, and that's on the individual person.
When I look at it, it can go so much farther, and we all have a story, and I respect that because I've got them just in my practice alone with people that were offered health care and health insurance and didn't take it. That's a private decision. What exactly is our responsibility, and does the government regulate it? I'm not sure. I think if these guys really looked at their businesses, they would say that the reason they offer the wellness that they do is because they know it improves their workforce and they get more out of it. If we really wanted to look at health care, we'd start with dentistry, and we'd say if you don't have your teeth cleaned twice a year, you're not entitled to basic and major dental, because everything starts in the mouth. So, I mean, we're looking at health care, and we're looking at wellness, and we're looking at health insurance. 3 different things.
Mr. Brewer?
One of the things that ACA did get right was increasing the opportunity for employers to incent people to well behavior. We've got a pretty sophisticated practice in our firm of helping clients design programs that incent people to live healthier lifestyles and make better lifestyle decisions. So, and this morass of things that we don't like in ACA, certainly that aspect of it was welcome.
I think there's 3 things I mentioned. One is I think you have to have an individual mandate, so everybody pays their fair share and gets coverage. I think employees need to know the total cost of insurance, including what employers are paying. Most of the time they don't realize how much it really costs. And we've seen in all our surveys and meetings with small businesses where 42% of Americans work, that small businesses would like wellness and prevention programs that fit small business, and they don't have access. We hope that exchanges run by states can do this there. And I agree that dentistry has some good models. I know I don't have to pay any copay if I get in there, and I think that is a good incentive, and it's been proven to work.
Well, on behalf of the Chairman, I'd like to thank you very much for your indulgence for 2 rounds, and thank you so very, very much. Thank you. Your meeting is adjourned.
Chairman, thank you very much.